Oh, I definitely don't have tongue tie. You see, did you see how long my tongue was? How much it came out? Because my tongue is free. Now, there's a condition called tongue tie in which something underneath the tongue, a little band of tissue, is anchoring the tongue down in the mouth, and it doesn't allow the tongue move freely. So people with tongue tie, children with tongue tie, the tongue is just inside. It can't move around freely. Okay. So why is it important that a child has tongue tie or an adult has tongue tie? For children, the number one thing that tongue tie affects is feeding, because the tongue, especially when they're breastfeeding or they're bottle fed, the tongue is what helps to apply pressure to cause milk to come out. So if the tongue is anchored down, it can't do that. So children with tongue tie have difficulties with feeding. So if your child, your baby is not able to suck very well, it may be tongue tie. The other thing it affects is speech, but not in the way most people think. A child with tongue tie will talk. He will talk on time. He will talk as he should, but he will not be able to produce certain words properly. He'll maybe words that expect your tongue to touch the roof of your mouth or come forward slightly, they will not be able to pronounce them, but they will talk. So if your child has difficulty with feeding, sucking from either the breast or the bottle, or as they grow older, they have funny speech. They speak, but they don't pronounce words properly. And even in adults who have what we call a lisp, sometimes it's due to the tongue being tied, anchored down in the mouth. And if this happens, see a pediatric surgeon, an ENT surgeon, and let them take a look at the tongue, assess it properly, and they might have to just divide it. Sometimes it's not the tongue tie, they might need a speech therapist to help them to pronounce words properly. So if you suspect your child has tongue tie, the first step to do if they're old enough is ask them to bring out the tongue. And if they can bring it out way out without anything anchoring it, I'm not too sure. But see your ENT surgeon and let's check it out for you. Have a good day.